A third modality for giving intraperitoneal chemotherapy or intraperitoneal targeted drugs is called PIPAC. So that's pressurized intraperitoneal aerosolized chemotherapy. And that's using laparoscopy and using the pressure of the laparoscopy in order to inflate the abdomen. We use 15 millimeters of mercury of pressure to inflate the abdomen, and then aerosolizing chemotherapy and using that pressure kind of inflation like a balloon to try to deliver the chemotherapy that way. And there's been several studies in Europe that I think in summary show relative safety of the procedure. I think it's hard to judge the efficacy because a lot of these studies included multiple different types of cancer and used multiple different drugs, but it showed that patients were able to go a couple of different procedures. And then the grade 3 adverse event rate, so it goes from 1, meaning relatively minor, to 4, meaning on the more severe side. But very few, kind of rare grade 4, the most severe complications, and maybe 1 in 6 had a grade 3. So I think that showed the general safety of this, at least in Europe. And then where I trained in Southern California at City of Hope, where they're investigating PIPAC with a couple of other centers in the US, but they're kind of leading this PIPAC trial in the United States. So that's where I trained, and I was a part of this trial using oxaliplatin as the drug and PIPAC for colorectal and appendix cancer. And this is phase 1, so again, we're just demonstrating safety and feasibility, but most patients were able to undergo more than one. And of these patients, of whom I would say have had a lot of chemotherapy before. They're on their second or third line of chemotherapy. So we know that these chemotherapies are, we're kind of getting to the third or fourth line chemotherapy. But in this patient population that's been pretty resistant to most of the chemotherapies, half of them had their disease at least be stable or actually improve. And again, only 1 grade 3 complication of pain from the procedure. So showed safety and feasibility, and I think that there's potential future for this kind of delivery of chemotherapy, in addition to figuring out what type of chemotherapy is the best. This one was oxaliplatin, but I know they're also investigating mitomycin C. So a lot of work to do to figure out which delivery system is the best and then which drug is the best.